Good evening, I'm Deborah Pinkerton. October is Breast Cancer Awareness Month. Penn State health specialists are here to talk about hope, courage, and the life-saving power of early detection. Breast cancer is the most common cancer diagnosed among women in the United States. Statistics show 1 in 8 women will have invasive breast cancer during her lifetime, but there is hope. When caught early in localized stages, the 5-year survival rate is 99%. Tonight, doctors will answer some important questions like, when should women have their first mammogram? What are the latest treatment options? And what does care look like after treatment? And if you have questions at home, Donna Kirk or Morgan is here to tell you how to get them answered. Hi, Donna.
Hello, Deborah. Sarah Sheets, breast imaging nurse navigator, and Christine Young, breast surgery nurse navigator at Penn State Health Breast Center are answering your questions in a live web chat until 8 o'clock tonight. To submit a question, go to abc27.com/breast. And I'll be back later in the show to share some of those questions that are coming in from viewers. Deborah.
Thank you, Donna. Typically, breast cancer does not have many symptoms when the tumor is small, which is why seeing it sooner is so important. A Dauphin County woman followed her doctor's orders and got mammograms every year, and she's glad she did. Holly Maitland-McKenna shares her journey. Holly Maitland-McKenna knows all the strokes. She is a swim instructor.
This year will be my 48th year teaching swimming lessons. And it is why I'm on the earth, as I always tell that to everyone, because I love what I do.
Holly wants to keep people safe. She cares, and that's why she goes above and beyond teaching swim lessons.
The longest was my 10th year, which was 46 hours that I swam at the pool.
Since 2013, Holly has swam hours upon hours to raise money for the kids to benefit for Diamonds. Her efforts have totaled more than $75,000, and here's why.
A parent should not have to hear your child has cancer. The same as a grown-up shouldn't have to hear you have cancer. So it's my way of helping.
So many years of thinking of others. Now Holly had to focus on her own health.
I've been getting mammograms since I was 40, and I'm 61, and I did have a few biopsies, but they were all negative.
Until this latest mammogram.
They found an area of asymmetry in her breast and were able to do additional mammograms and ultrasounds and do a subsequent biopsy. Our dedicated breast radiologists are able to then confirm that the area of suspicion is biopsied. And since we got the results, we did find out she had a very early breast cancer.
Holly had to come face to face with the very word she doesn't believe anyone should hear: cancer.
I was really shocked, and I just carried on. It was like, okay, we're gonna get through this.
A positive attitude the Penn State Health breast cancer team embraced. They immediately put a plan into action.
They explained everything to a layperson, all the big words and what they mean, and what happens from this point to this point to this point. And really, you just take it one appointment at a time.
Thankfully, it was a very small tumor, caught early because she did do her annual screening mammogram. On her MRI, there were no additional areas of suspicion, so she was a great candidate for a lumpectomy or a mastectomy.
Holly chose to have a lumpectomy.
Holly came in prior to the surgery here and had a little reflector placed to let us know exactly where to go. Day of surgery, I met her in the operating room. We were able to take a small area in her breast to remove that cancer without deforming or causing any changes in the shape and size. We did sample 2 lymph nodes, which were both negative for any cancer as well.
It was fine. I mean, everyone at the hospital was so nice. It was done. I was in and out in the morning, out by 2 o'clock in the afternoon.
An outpatient surgery that saved Holly's life.
It was a whirlwind. That is the best word for it. Just, it all happened so fast. I was in, I was out, and we caught it early, which was the key. Out of all of the times that I've had mammograms over the years, they caught it early.
What I tell Holly and all my patients, I know there's a lot of anxiety that comes in when getting your annual mammogram. You're worried about the results, you're worried about what they're gonna say. But what I tell all my patients, often the hardest part is diagnosing a cancer. So if we can see it sooner, give you treatment that allows you to live the quality of life that you wanna live, that's really my goal for patients.
And Holly says she feels great. She hopes women watching will realize the importance of getting mammograms every year so doctors can see it sooner. And joining me right now is Dr. Christine Witters, breast surgical oncologist and co-director of the Penn Health Breast Center. Thank you for being with us.
It is a pleasure.
Early detection saved Holly's life. She is so grateful for this. Talk about when you see it sooner. How important are these yearly mammograms?
I think the biggest benefit for seeing it sooner is it really allows women to have options. As you saw with Holly, one of the important things was keeping busy, continuing to raise funds for 4 Diamonds. Seeing it sooner allowed us to do a minimally invasive surgery, allowed us to let her keep continuing the life she wanted to live and not impact her overall survival.
Yeah, mammograms, so important. And we do want to remind our viewers, you can scan the QR code on your screen right now to schedule a mammogram at Penn State Health. When we talk about breast cancer and someone receives that news, shocking would be the first word I would say, but then they have to think about everything that's going to happen next. Your team really embraces them and comes up with the next steps.
I tell my patients often, whenever you hear that word cancer, it triggers an emotional reaction. We all want it off yesterday. So we really try to help our patients. As you'll hear from later this evening, one of the best resources we have is our nurse navigators. They're willing to call our patients same day they call in for appointment or next day reach out to them to go over their diagnosis, help alleviate some of those concerns. They also help facilitate getting them in to see other different specialists they might need along their treatment, such as plastic surgery or genetic counselors or medical oncology. We really try to alleviate those women's concerns and help them keep moving through their treatment.
So someone being there with them every step of the way. Talk to us about the latest surgical treatments that are available.
I was reflecting on this earlier today. A lot of our surgical treatments are twofold. Some of it's offering women more options, whether it's plastic surgery with oncoplastic reconstruction, reductions in implants. The other part about it is we're actually doing less. We are trying to find ways to let women live as long as they can, but also have the least amount of impact on their life and the quality of the life they have moving forward.
Let's talk about timing. How important is timing after diagnosis?
Timing is of the essence. What we tell women is there are data that does show if we can get a cancer out within 60 days of diagnosis, they do have improved survival. There is information we do have to get though, so that's why we use our navigators and other resources to help move them along that pathway. But we understand it. We're trying to get them in as quick as possible. We keep opening up more access, whether it be in imaging or whether it be in surgical consultations, so that we're available for patients when they need us.
Yeah, and that's certainly what they want to hear. Dr. Witters, thank you so much for being with us.
Pleasure.
And if you would like more information or if you would like to schedule your mammogram with Penn State Health, scan the QR code on your screen right now. And let's check in with Donna Kirker-Morgan. Donna, what are some of the questions being asked tonight?
Deborah, we've had a wide range of questions coming into the web chat. Sarah Sheets, breast imaging nurse navigator at Penn State Health Breast Center, has been busy this evening. And here's our first viewer question. What does a breast health nurse navigator do, and how do you help patients get through this, trial of this journey with breast cancer?
So as Dr. Witters alluded to earlier, we do a little bit of everything. We make sure that when we call a patient with a diagnosis, we have their first appointment set up so that we're not just calling them without a plan. Then we start working on all of the different pieces of their care, and it's very individualized.
Now, this viewer is asking, what kind of emotional support do you offer for patients and their families? And boy, is that needed in this kind of, just terrible, scary time.
Yeah, so in addition to just being there for all of their questions, we do have different support groups. So we have a monthly support group that we offer for our patients, and we also have a kids support group for patients who have young kids. We have a group called Climb, where we have the kids come and meet with them, and help them through the process, which is really neat.
So what is that? Explain more about that.
It's for school-age children, and they come in, they get to meet other kids whose parents have cancer, so it's not so isolating. We actually have a group running right now, so we have a great time with them.
Oh, and it just got to be so wonderful that the children can share their fear of what's going on with their mom.
Yeah.
Oh my gosh.
We talk a lot about feelings.
Okay, and if you have any questions for our nurse navigators, go to abc27.com/breast and submit your question. And as a reminder to our viewers, you can scan the QR code on your screen right now and schedule your mammogram with Penn State Health. Do it. Stay with us. We'll be right back.
You're watching Hope and Courage, a tribute to breast health on ABC 27, sponsored by Penn State Health.
Welcome back. Seeing it sooner helps in the diagnosis, treatment, and recovery of breast cancer. A Dauphin County woman shares how she discovered something just wasn't right. Earlier, I spoke with Lakia, and here's her journey. Lakia, thanks so much for joining us. I understand that your dog may have played an unexpected role in your diagnosis. Tell us about it.
Yes, for sure. I have a 6-year-old poodle mix named Remy, and she's definitely the queen of our house. So the particular incident that led to my diagnosis of ductal carcinoma was I was laying on the bed reading, and she decides that she wants to get to the other side of the bed. So she literally walks over my chest. That's when I started to see the symptoms, and I would have never thought, because I didn't have a history of breast cancer in my family, I would have never thought that it would eventually lead to a diagnosis of breast cancer.
What is your recommendation to women as far as paying attention to their bodies? And if something doesn't feel right, really call the doctor.
So I decided to reach out to my primary care doctor, who's also a Penn State doctor, Dr. Daniels. And I went to see him, and he suggested that I actually went and got an ultrasound and a diagnostic mammogram. They didn't find, they didn't detect any cancer. But it was a doctor on staff who was reading through the results. Her name was Dr. Jackson, and she came into my room and she suggested that I got additional testing, and also gave me the statistics of Black women dying at a higher rate of breast cancer than other women for various reasons, but one of the reasons is lack of early detection.
So what were the next steps?
So the next steps after that, I went and got an enhanced breast MRI, and they found a suspicious area. That's when they caught it. They found a suspicious area, and from there, a biopsy. And that's when I was told about my breast cancer diagnosis.
That must have been shocking.
I was shocked, again, because I don't have a history of breast cancer in my family.
So how did Penn State Health help you through this very difficult journey?
Man, I can't even say enough. I always tell everyone that they provided world-class service. From Dr. Daniels being concerned to Dr. Jackson suggesting more testing, which I really believe that was the thing that really, saved me for early detection. And I'm so grateful, and my family's so grateful to have all of these people. They're angels on earth.
So well said. So what would you say as far as changing your perspective on life? We talked earlier and you said that you lost your parents to cancer. Now you have this diagnosis. And then also your daughter is now pursuing a career in oncology because of this. So how has your perspective on life changed?
Well, it's changed a lot. You know, growing up, my parents always taught me health was wealth, but unfortunately, they didn't practice what they preached. My sister passed away from medical complications from not going to the doctor. I had a friend who passed away at the age of 40 from colon cancer, from not going to the doctor because it was too far gone. My grandmother died of ovarian cancer. And my daughter knows all too well the effects of not taking care of yourself and not getting your screenings, and how it's literally a life or death situation. And she was never able to meet my mother because my mother passed away before she was born. And I was never able to meet my grandmother because she passed away when she passed away before I was born. My daughter, who is a brilliant young lady, wants to be a part of the solution so more granddaughters can have a life with their grandmothers.
Wow, that is wonderful. Penn State Health really encourages women to see it sooner by having those yearly mammograms and screenings. What is your message to encourage moms and daughters to do just that?
It's so important. What I would encourage is that for moms to be the role models. Show your daughters once they get a little bit older, you know, tell them, I'm going to get a mammogram and I'm getting a mammogram for this reason. And instill in them the importance of seeing it sooner because it can save lives.
Yeah, absolutely right. And you're doing that with your daughter. Wonderful. Wonderful to hear. That's for sure. Lakia, thank you so much for being with us.
Thank you for having me.
Such a great job. You can hear she's so excited about this and really wants to tell as many people as possible, get your mammograms. You want to see it sooner. Joining me right now is Brianna Clark, breast surgery nurse practitioner at Penn State Health Breast Center. As we heard, Lakia really credits her dog from jumping on her. She's realizing that something's not right. How did the Penn State Health breast cancer team really work together to say, yes, you should have more tests?
Sure. Well, as she had mentioned, her initial mammogram didn't show any signs of breast cancer, but our breast radiologist, Dr. Jackson, recognized that based on the symptoms that she had been having and her elevated breast cancer risk, that she really should have a breast MRI, which has a lot more sensitivity, and that's ultimately what led to her diagnosis.
Yeah, that was wonderful. What advice do you have for women who may be thinking, well, I feel something or something just doesn't feel right, and then they're like, no, I'm just overreacting. Sure. Maybe I really don't need to go to the doctor. I was about to make the phone call, but no, didn't. What is your advice for them?
I would say trust your gut. We all know our bodies, and if there's a change, definitely don't hesitate. Reach out to your healthcare provider and let them know so we can investigate.
And how do healthcare providers really advocate for women who are they're pushing for themselves and making that telephone call?
Sure. Well, as healthcare providers, we'll always tell you what our honest opinion is clinically, but we also recognize that, again, you know your body, and so sometimes you do have an intuition, and we need to trust that and check things out a little bit more. The last thing we'd want is to miss an opportunity to see it sooner, because we know that better prognosis is if we can catch it early.
Yeah, see it sooner. That is key. As we heard, Lakia does have a family history of cancer. So what programs, what services do you offer for women who are considered high risk?
So with our high risk program, we perform some risk calculations to figure out what your lifetime risk is of developing breast cancer. And then sometimes based on certain risk factors, we also offer referrals to genetics to consider testing for mutations such as BRCA. We encourage women to have their annual screening mammogram. And then at a 6-month interval, we'll also offer the breast MRI or automated whole breast ultrasound as another means of enhanced screening surveillance. And for certain high-risk women, there's also risk-reducing medications or even potentially surgical options to discuss.
And if you do have concerns and you think that you may be considered high risk, it's something that you should talk to your doctor about.
Absolutely, because the sooner that you have that risk evaluation, the sooner potentially that you could start screening and have the enhanced imaging surveillance like breast MRI and automated whole breast ultrasound available to you.
Great. Thank you so much for being with us.
Absolutely. Thank you.
And if you would like more information, or if you would like to schedule your mammogram with Penn State Health, scan the QR code on your screen. Now let's check in with Donna and get more answers to our web chat questions. Donna.
Very busy here at the web chat desk. Joining me now is Christine Young, breast surgery nurse navigator at Penn State Health Breast Center. Now, this viewer is asking, how do you coordinate care between doctors, surgeons, and patients to make the process less overwhelming?
Well, I think very similar to what Dr. Witters had mentioned. Sarah and I tend to call ourselves the go-to women. So if there's a question that a patient has regarding their care, their treatment, we always say, give us a call. We do a lot of arranging for genetic testing, for medical oncology, radiation, plastic surgery.
And you can reach out to all those throngs of medicine.
We try to make it as least stressful as we can for them, because there's just so much going on already.
Absolutely. This viewer is asking, what advice do you give to women about talking to their daughters or young family members about breast health? Very important.
Huge. I think Brianna started to touch on that a little bit, in that, it's important, and Lakia talked about it as well, talking about her daughter, saying how she went in and was getting her mammogram. I think we live in a day and age where we're a little bit more open about our health, and that's really important. The key is for young women to be breast aware. Notice if you have any nipple changes, any redness, dimpling, discharge. These are all things that we want to make sure that, while they might be nothing, we want to make sure, get them checked out. It's better to be safe than sorry.
Our family has a large amount of breast cancer along the female side, and I have been tested negative for the BRCA, but you said there's a lot more genetics that I could continue checking into.
There's, don't quote me on it, but there's probably 20-something gene mutations that we've discovered to date. So most commonly it was the BRCA1 and 2, but as our research has developed, we're finding more and more genes. So if somebody has had testing, but it's been several years, they should check with their provider to see if maybe they should have additional testing done.
Perfect. Thank you, Christine and Sarah, for answering our questions tonight. They'll be here until 8 o'clock, so there's still time to send in your questions. Go to abc27.com/breast to submit your questions. And back to you, Deborah.
Thank you, Donna. Joining me right now is Dr. Allison Chetland, Breast Imaging Division Chief and Co-Director of the Penn State Health Breast Center. Thank you for being with us. So let's talk about the current screening guidelines, and why is the message "seen it sooner" so critical?
The current screening guidelines recommend that women begin screening mammogram at age 40 and continue every year. However, around age 25, we urge all women to talk with their primary care provider and talk about their risk. They might be at higher risk, which might mean we need to start a little bit earlier with screening. It's really important to get the screening mammograms because we want to find the cancer sooner, which gives women more options for treatment.
And so when should women consider, say, an ultrasound or an MRI?
Depending on the woman's risk status, we talked a little bit about high risk. If they're at higher risk, we have other tools in our toolbox besides just the mammogram. If a woman is at high risk, we have these other options. They're called supplemental screening, and those are MRI and or ultrasound, and we often alternate them every 6 months with the mammogram. We also think about breast density. If a woman has dense breast tissue, then other imaging modalities are often recommended.
Yeah, let's talk about breast density, because that's a whole complicated matter for women who do have dense breasts.
Yeah, about 40% of women have dense breast tissue. This isn't something that you can detect on your own. We really need the mammogram to determine what the breast density is. The breast tissue on a mammogram is white, and cancers are white. So it gets a little trickier to look for non-palpable early breast cancers when a woman has extremely dense breasts. I think of it like if you have a big snow pile and you're looking for a white golf ball, it's going to be a little tricky to see that golf ball because there's a lack of contrast. So in women with dense breasts, we have other imaging modalities which complement the mammogram to help us see the cancer sooner.
And that is really important. I know that when I get my mammograms, it says extremely dense breasts. So then I have an ultrasound every 6 months and then the mammogram. So it's really important to know what your situation is.
It's really important. And you know, there's national density legislation. So all women in the United States now know what their breast density is. And this legislation has been so powerful, and the advocacy behind it has been so powerful, because I think women deserve to know what their breast density is, and they can take the steps that they'd like to help screen for breast cancer.
What is your message to our viewers tonight who are watching who may not yet have had their mammogram or they're behind?
We're ready for you to schedule your mammogram with us. You can do that by calling to schedule the mammogram. We have an online portal. You can scan the QR code. We'd like you to help us see it sooner. So please come and get your mammogram. It's so important.
Yeah, and that's certainly the message. See it sooner.
Yes.
It does make a difference.
It does.
Dr. Chetland, thanks for being with us
Thank
this
you.
evening. And we send a special thanks to Holly and Lakia for sharing their stories, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to schedule your mammogram with Penn State Health, you can scan the QR code on your screen. Ladies, tonight's program is a perfect reminder to schedule your mammogram if you have not done so. Seeing it sooner makes all the difference. It will save your life.